The lunge test is a weight-bearing or functional assessment of the ankle joint. The ankle joint is formed by the tibia, fibula, and talus and allows for dorsiflexion and plantarflexion of the foot in the sagittal plane. Weight-bearing examination of the ankle involves range of motion assessment of available dorsiflexion with comparison to normal values or the patient's required values. These values may differ for the patient to be pain-free with optimal function. Results are assessed for signs of impingement, sagittal plane block, or Equinus. Symmetry of motion assessment. Bilateral comparison to identify any asymmetry of function. Clinical tests. Quantification of results uses either distance from the wall or angle of the tibia to assess success of interventions including physical therapies. This functional assessment is combined with non-weight-bearing joint assessment and gait observation as the ankle plays an important role in all phases of gait. Management options are dependent on symptoms, type of block, and treatment-directed testing, and may include physical therapies, footwear choice for optimal drop, or heel raises. For more information on DOLA Orthotics, visit dolaorthotics.com. Subscribe to our YouTube channel or follow us on Instagram or Facebook.